So looking at the mental dimension, which is actually, when it comes to treatment, perhaps the most important dimension, because this is where we need all the changes. Since we know that the physical allergy is something that has to be accepted and abstinence is what needs to be practiced, we know that the only thing that can help us practice that abstinence is the lifting of the mental obsession that makes one pursue the addiction. For addressing the mental dimension, we need to remember that addiction is like a poisonous plant that has its shoot in the conscious mind and in the behavior, yet its root is deep down in the unconscious or the subconscious, as we call it. Now, to be able to access these roots and get rid of these roots, we need a form of therapy where we can access the unconscious. Hence comes the role of medical hypnotherapy. It is a practice that has been in medicine for the last 200 years, but in its currently developed state, it has very recently come into allopathic medicine. And there are very, very few practitioners anywhere in the world who are able to deal with the de-addiction aspect through medical hypnotherapy. As we know that, as the name is suggesting, medical hypnotherapy is a specialized branch of hypnosis applied specifically to medical disorders. Here, we would be practicing de-addiction hypnotherapy, where with the help of 21 sessions, gradually these roots will not only be accessed, but they would be actually, the plant would be derooted from right there, and changes would be made right there by planting new seeds of recovery deep in the unconscious. This is done through group hypnotherapy sessions. Also, in the mental dimension, we have to look at various forms of psychotherapy. At RAW, we provide various psychotherapies such as cognitive behavioral therapy, commonly called CBT, where the mental processes and the behaviors both are targeted and changed, and an insight is provided to the patient so that they are able to see the kind of emotions that disturb them, what those emotions are related to, and what can be done to change these emotions as well as these thoughts. Also, rational emotive behavioral therapy, which is the original form of CBT, is something that is taught at ROAR to the patients, because this is an extremely helpful tool for the overall lifestyle mentally of the patient, because to change one's limiting beliefs, whether it has to do with addiction or other negative aspects of one's lives, the model that is extremely helpful is the rational emotive behavioral therapy model. So at ROAR, we make sure that our patients master this model, and by the time they step out from here, they are able to use this model in their day-to-day life as and when required. Also, we focus on EFT, or Emotional Freedom Techniques, which is an American therapy based on principles of Western psychotherapy and the Chinese meridian system, the same one which is used in acupuncture and acupressure. Here, emotions are addressed, and with the help of addressing these emotions, we are able to not only get a freedom from these negative emotions, but we are able to deal with a lot of psychological disorders such as depression, such as phobias, such as panic attacks, such as anxiety. And we are also able to deal with many physical symptoms like various aches and pains, which are quite common in recovering addicts. So EFT again is a very, very useful self-help tool which the patients can be taught to master, and along with an emotional freedom that they achieve from it, they are able to use it as an extremely effective tool to manage any cravings if they ever have them in the future. So it's extremely effective for cravings as well. Then we have a program called Mindfulness-Based Cognitive Therapy Program, or simply MBSR, or Mindfulness-Based Stress Reduction. Here in this program, in about 8 weeks, a person is trained to develop more awareness and more mindfulness with the help of 2-hour sessions every week. And in these sessions, one is gradually able to access the unconscious and also change one's anxiety levels and come to a much more calm state. And it is probably the only medically studied and standardized program in the world which was developed in the University of Massachusetts by Dr. Jon Kabat-Zinn. And there are very few places where it is practiced, and it has been found extremely effective in all psychological disorders, particularly where the psychological disorder also has a physical component, such as chronic pains or depression or addiction. It is also found that addicts have a tendency to go into depression during the first 2 years of recovery. So this program also is an extremely effective preventive program for depression. So it not only helps the addict during the phase when they are in recovery, but also prevents any development or possibility of development of depression. Apart from this, we train our patients in various other skills such as meditation and yoga. Meditation is one of the oldest forms of relaxing one's mind. In fact, even before medicine was developed, this meditation and yoga were practiced by ancients to keep the body and mind healthy. So as a preventive program, we find that this wisdom of the East comes very handy, and our community here is trained in both yoga and meditation as preventive health programs for their body and their mind. Also, we use various alternative therapies such as color light therapy, music therapy, and aromatherapy during many of our sessions. These kill the monotony of classroom sessions or medical procedures and make the sessions much more interesting, at the same time helping the patient in a holistic way to lift their moods and to stabilize in this initial phase of recovery.